Welcome to the second video presentation of the student evaluation. In this presentation, I will be talking about issues related to clinical failure. When we ask, how do I know if the student is passing? The answer I have heard to this question is often in the form of a question. Is the student safe? Well, how do I know? It depends upon the level of the student and the timing within the course, as well as the timing within the program. It only makes sense that as the student nears the end of the particular rotation and the program, our standards of passing are higher. As the student gets closer to finishing the entire nursing program, our standards of passing should be higher. We expect more from them than we would in their very first rotation. We as clinical instructors are the gatekeepers, ensuring nursing students can think and function professionally. And it's also about consistency and repetition. How often is the student able to demonstrate appropriate behavior? Or how often are they making mistakes despite having the behavior pointed out to them, discussed, and corrected? We must remember that how students perform professional practice as students will be the way they practice as professionals. Sometimes as clinical instructors, especially when we first begin, we might overlook some marginal behavior because we're thinking that as the student moves through the program, they will gradually improve. But how can we be sure? This is a real concern. This emphasizes why communication with the nursing program becomes so important. Communicating your concerns with the lead instructor or the clinical coordinator is paramount, especially when you're a part-time instructor. As a part-time instructor, you may not have regular communications with the nursing program other than during the clinical rotation, and most likely only in the beginning and at the end of the rotation. You most likely do not know about any other concerns or about how the student is progressing through the remaining rotations of the program. The article Failing to Fail confirms my personal observations. Failing a student is difficult for faculty. It can sometimes be difficult to be confident about a student's incompetence and safety concerns, as well as to go forward with failing the student. And we know it can be emotionally devastating to a student. However, it only gets worse if the student is allowed to continue farther along in the program. Instructors want students to be successful, and when they're not, sometimes we think that we as the faculty are at fault when students are not successful. However, it's important to remind ourselves that it is the student who fails to meet the level of clinical competence, not the faculty. Some guidance can be taken from Tanaka's study, where experienced faculty identified 5 factors to consider when assessing safe patient care rendered by students. The factors are safety, thinking, ethics, communication, and standards. We as instructors are expected to be able to anticipate the answer to the question: are students able to perform safe patient care? If a student's behavior poses a threat to patient safety, this might constitute a failing grade in the clinical course. What we do know is that the knowledge and experience about patient safety is gained during the clinical experience, making safety a crucial element of what must be learned. Therefore, it is our responsibility during the clinical experience to ensure that the student not only practice safely, but also habits of safety must be reinforced. We as clinical instructors are the gatekeepers, ensuring that the nursing students can think and function professionally. It's about consistency, repetition, and improvement. How often is the student able to demonstrate appropriate behavior, or how often are they making mistakes despite having the behavior pointed out to them, discussed, and corrected? The number one area of concern, as I mentioned, is safety. Giving medications and avoiding medication errors is a high-risk patient care activity for patient safety. What if a student makes a medication error? How many medication errors could or should we allow a student to make without failing a student? These are questions that most likely can only be answered by the context of the experience. What actually happened? Did the error cause harm to the patient? First, it is highly likely that most errors are multifactorial. I was involved with a student that made an error. In assessing the incident, I was able to see that it was not completely the student's fault. However, I did find that the student wasn't following protocol. I was able to determine it was partially a systems problem that set up the situation. The student, being inexperienced with both giving medications and the unit, was primed for the mistake. What about thinking? Can the student put the pieces together? Can they bring the didactic information into the clinical? Do you see evidence of thinking? Can they observe a patient's condition and tell you what they think is going on or what should be done next? Can they look at the patient's lab data and discuss what they think it means? Do you see someone that seems lost or displays this behavior week after week? Or can you see progress? The student's clinical reasoning ability needs to equate to the student's scope of practice in the program. What about communication? What about being able to communicate respectfully? I've had to deal with this issue several times in a clinical rotation. At times, students do not seem to understand what the appropriate professional communication should sound like. I've had to counsel students regarding this issue. This needs to be pointed out almost immediately, although discreetly. What about failing to communicate something which is appropriate? In Tanakawa's article, she gives an example of a student failing to report a blood sugar reading, which potentially puts a patient in danger. What about the shy student? One that is too intimidated to communicate. Here, we really need to stress the importance of why communication is so important. Shy, intimidated, or quiet students must learn to overcome their shy quietness in order to be an advocate for their patients as professional nurses. This is a potential safety concern. To pass a clinical course, achieving the standards and meeting the objectives is considered the minimum. Students need to practice within their scope of practice of where the student is today, where they are in the program today. Are they meeting the objectives of the course? We can only know that if we use the rubric of the student's evaluation to help answer that question. Let's talk a little about ethics. Are students reporting their assessment findings accurately? Are they actually performing the assessment? You might think, if they are not performing the assessment, then what are we doing about it? Sometimes students are doing the assessment, but not completely engaged in their findings. Maybe this is the explanation. Here's an example that I found happens all too often. The student has already assessed the patient. Now it's time to administer an IV medication. One of the questions I have asked the student is, does the patient have a running IV? And I've received a blank look. So I asked the question a little differently. Does the patient have a saline lock? I might still get a blank stare. Then I began to get concerned. Maybe the student didn't fully assess the patient. Now I have the student return to the room to repeat the IV assessment and to answer these questions. As a nurse, they will need to know this information in order to prepare for the administration of the medication appropriately. If this should continue to be an issue, then I would need to take appropriate action, which could include directly observing the student when they are performing an assessment, or I could have the student tell me how they will perform the assessment before their next patient assessment. What would you do? Do you suspect a student has come to the clinical experience impaired? Are they overtired? Did they work the night before? Or are they under the influence of medications, drugs, or have health-related issues which could impact or is impacting their performance? These are all part of ethics and looking at whether or not the student is practicing safely. It is always best to take a student aside and be direct in your assessment. Make sure you follow the impairment policy of your School of Nursing. Should you send a student home, make sure you provide for the student's safety as well. Failing the clinical rotation should never be a surprise. To complete the student evaluation, make sure you are thoroughly familiar with the evaluation. Use a strategy to record student performance observations, as well as a consistent strategy to deliver prompt, prescriptive feedback. As nurse educators, we must pay attention to the procedures used when handling student dismissals, because Nursing students are slightly more likely to sue, and nursing programs are slightly more likely to lose than other academic programs. This is why documentation becomes so important. Between 2010 and 2011, the director of a Kansas Associate Degree Nursing program, I quote, convened a meeting with the students who had posted photographs of a patient's placenta on Facebook, where she verbally berated the students by screaming and crying at them. This is according to court documents. The students were then, quote, summarily dismissed. However, the court found that the appeal process that the college provided to the students was not a fair and unbiased opportunity for the student to fully present her case before a neutral and unbiased arbitrator. Per the court documents, the instructor had granted permission for the student to take the picture and may have consented to its publication on Facebook, but the student did not get an adequate chance to make that argument because of the dismissal. The court observed that photos are taken to be viewed and that by giving the student permission to take the photos, which the instructor admitted, it was reasonable to anticipate that the photos would be shown to others. Policies are in place for students to appeal their grades, both didactic and clinical. If you did not receive information about the appeal process, ask and find where these policies are located at the college and review them. Consider discussing this case with your mentor during the mentoring session. If you need more information and strategies to deal with a struggling student who may be at risk for failing, once again, I recommend you read the article, Strategies for Precepting the Unsafe Student. You can find the link under the supplemental reading section. After your discussion with your mentor, please complete the module evaluation. Here are the module references. Thank you.